Assisting our community with public health. Gina J. Ramana Spacey, HCA 14, Community and Public Health, Instructor Engineer, 9 November 2015. Community healthcare. Assisting communities with healthcare is a moral obligation. Essential services to prevent health disparities should be available to all Americans regardless of ability to pay. The need for community healthcare is a priority to maintain elevated service to individuals in a manner in which they would best use gain to reduce the overall healthcare spending the government is required to pay. The structure of the American health system model is one which allows for private enterprise and technological advancements to flourish with competition. Legal and ethical considerations are important to medical personnel when delivering services because we have a culturally diverse nation with different social issues depending on community. The funding can be from government sources found on the healthcare marketplace through private insurers or self-pay. Communication and education is what facilitates the health of our communities by offering health classes, food, or clothing. Public health is essential. Community health workers, CHWs, are trained medical personnel living and working in the communities they serve. According to Quebec et al. 2015, CHWs have specific training in providing basic nutrition and health promotion services. These services are intended to improve the overall health of the people living in a community by individuals who know them best and are able to communicate most effectively. Improving the health of a community involves educating the children as well as the adults, providing classes for parents and adult individuals on proper nutrition and exercise will help ensure current residents and future generations learn to care for themselves and seek medical attention only as a preventive measure and for true life-threatening emergencies. With the passing of the Affordable Care Act, all Americans are guaranteed access to health care services. In an effort to reduce the overall deficit for health care spending, preventive medicine is essential. By providing the basic health care needs and immunizations to all communities, we ensure that the future of health care spending is reduced because healthy communities have less necessity for seeking medical treatment. Organizational structure. There are primarily three models to healthcare systems: Bismarck, Beveridge, and National Insurance. The Bismarck model is mostly commonly utilized by France, Germany, Austria, Switzerland, Belgium, Holland, and Japan. The Bismarck model has premiums funded, is mandated insurance, and is offered by public and private providers. The Beveridge model is most notably followed by the United Kingdom, Italy, Sweden, Spain, New Zealand, Norway, Finland, Canada, Hong Kong, Denmark, and Cuba. The Beveridge health system model is a national health service funded by taxation with limited coverage provided by the government and public entities who maintain a tight control of costs. The American healthcare system is one in which most closely resembles that of national insurance. Taiwan is another country modeling their healthcare system after national insurance, and both these countries allow private and public providers to participate in delivering healthcare services to its citizens. By allowing both private and public sectors to compete, the national insurance model is able to offer services in advanced medicine and treatment practices which otherwise can be unavailable to individuals with large government control of healthcare services, delivery, and payment. Public health is a priority in America, and thus several beneficial programs have been initiated. Legal and ethical dimensions. The American health system has an Office of Government of Ethics, which is responsible for operations and lawmaking for healthcare services. The Office of Government of Ethics is in place to ensure protection from laws which may otherwise harm an individual by working against the good of the public. There are 6 focal points maintained by this office: ethical standards provided by medical personnel, a system of financial obligations to patients, enforce laws and ethics within executive branch ethics programs, continued professional training for ethics officials and executive branch personnel, performing public services to educate communities and provide health information, and sharing the knowledge of good practices with providing technical assistance to state or local governments and international organizations. Legal considerations are an ongoing concern for medical personnel when providing healthcare services to the public. Medical technology continues to advance. Medical personnel must be informed on social issues when providing healthcare in a confidential, dignified manner while decreasing harm and improving benefits in a transparent and informed patient delivery. Patients must be explained in common language the nature of procedures to take place and options available for necessary treatment. Healthcare personnel should be able to relate to their patients with understanding and knowledge of community issues to provide the best service possible for optimal health benefits. Funding for health services. Various methods are available for funding healthcare services. Above all, the Affordable Care Act reassures Americans that everyone will have the basic essentials of preventative health accessible to them, regardless of the ability to pay. The government essentially offers Medicaid, Medicare, and CHIP, Children's Health Insurance Program, to individuals who meet qualifying standards of age, income, and possible disability. These programs offer a basic coverage of medical health needs at low to no cost for eligible individuals. There is also private insurance, which may be offered through an individual's workplace or found on the health insurance exchange. Private insurance comes at a share of costs, yet benefits of care to the individual are increased depending on the level of coverage the individual desires. Another option is self-pay. Although all Americans are supposed to have health insurance through the government or private insurers, there are those which may elect to pay out of pocket or pay for services their insurers do not cover. Communication is key. Communication is the key to building stronger, healthier communities. Community programs offer much-needed services such as food, clothing, immunizations, and preventive health care appointments. Many families are unable to purchase adequate food, clothing, or obtain health care for themselves or loved ones. Community programs are funded by local charities and businesses with an aim to improve the overall health of the neighborhood residents. Vulnerable populations may go without it if it weren't for the charitable contributions of their more fortunate neighbors. Low-income individuals or families, women and children, individuals with addiction or disabilities are some of the vulnerable groups which rely on community programs to fill the gaps in coverage from education to food to medical care. Community centers provide enriching health education and parenting classes for vulnerable populations to improve awareness and increase accountability for one's own health care. Review of public and community health care. In conclusion, community health is everyone's responsibility. It requires a team effort from all healthcare personnel to assist in prevention through basic health services, immunizations, education, and outreach programs within the community. Community healthcare workers provide an invaluable service by being able to communicate with individuals from a place of understanding and furthering the reduction of healthcare spending by reducing unneeded visits to emergency care departments with preventive health appointments. The organizational structure of the American health system is one of a national insurance model which enables medical advancements to force the debt of other countries with the encouragement of private enterprise. The Office of Government Ethics ensures all laws are for the best possible outcome to individuals while delivering health care with minimal harm. Our medical personnel are specially trained to deal with moral and ethical concerns for individuals with different social issues. The funding for public and community health services is provided by government, private insurers, and self-pay. Community programs are also funded by local charities and neighborhood businesses with an intention to better the residents as a whole. Remember and practice good communication between medical personnel and individuals seeking health care will help prevent unnecessary treatment through the education of preventive medicine, immunizations, and healthcare classes. Everyone is reminded to take an active role in the health of our community to promote wellness.